Next, we have Assistant Professor Owen Schaefer from the Center for Biomedical Ethics, Yong School of Medicine, National University of Singapore. Owen's primary interests lie in the ethics of developing novel biomedical technologies. His talk for today is From Open Data to Open Access, Ethical Trade-offs in Open Science.
Yeah, thanks. Thanks to the organizers for inviting me. It's great to be back at NTU to talk about some of the ethical pros and cons of open science. I think, yeah, so far we've had a lot of very positive comments. I think very useful discussion of the value of open science. I don't want to be seen as something that's negative or naggy. I see things, I see ethical issues as often involving trade-offs, often involving certain values that are promoted at the expense of others. Doesn't mean things like open science aren't well defended, but we should be aware of these trade-offs, and it can inform the sort of approaches we take. And I'll keep an eye on the time, but I might want to make a comment interestingly about how some of the things I have to say intersects with, say, the trust platform. Yeah, so I'll focus on two topics specifically, and I'll try to divide evenly the time between these two. One is about trade-offs in open data, right? Open sharing of data. I might ask how open we mean open sharing of data. And then I'll also look at a slightly different area of open access publications, and that through the lens of a problem of distributive justice. So my view might seem fairly anodyne, the idea that there are trade-offs with almost any policy decision, including open data, but actually there are some statements that have been made that deny such trade-offs really exist, that we can have open science without any real downside. So this is Alondra Nelson, Deputy Director for Science and Society at the White House in the US, and she said openness and security are not contradictory, right? They are complementary and mutually reinforcing. To imply otherwise, to imply a choice between openness or security, would be a serious mistake. Instead, we must have both openness and security. And you can understand the sentiment that you can share data openly without risking data breaches or without risking misuse. It's a good policy goal to have, but to me, it's a bit like wanting to have your cake and eat it too. Okay, so we want to think about open data as promoting reproducibility. We heard talks earlier about that value, limiting integrity violations, improving confidence in results, as well as, of course, facilitating further research, creating greater value. We also heard about how it's valuable to researchers themselves for your own productivity, for your own citations and your own research collaborations. And at the same time, we want to minimize breach risks and minimize re-identification risks. You might think with enough security protocols, we can have both. But I'll highlight two ways in which there is a trade-off here that we really need to address, that we can't fully escape, even if we try to ameliorate it to a certain extent. So one of the trade-offs relates to misuse. So you're going to make attempts through techniques such as anonymization, through security protocols, to minimize the risks of a breach or the risk of re-identification, either inadvertent or malicious. But that doesn't mean you can eliminate those risks entirely, right? And with openness of data, the more parties with whom data is shared, the more different repositories where data, especially identifiable data, is shared. And I will say here on data about humans, I should say, where the risk of misuse is highest. The more risk of a security failure there is, okay? The more risk that a vulnerability can be exploited maliciously. And we also talk about anonymization techniques, and there has been, in recent years, more and more sophisticated attempts at anonymizing data sets while still retaining their value, and those are valuable efforts. But there's also commensurate effort and more sophisticated re-identification attempts, right? And what is now a data set that is unable to derive what the individual's identity is from that, could be in years to come, that re-identification becomes more feasible. This is maybe particularly acute with genomics, genomic data, where the fine grainedness of data in the future might become readily identifiable with more understanding of the genomic correlations with things like physical appearance or other phenotypic traits that can be identifiable either with own data sets or with easily accessible public data sets. There have, of course, been some re-identification attempts, for example, of supposedly anonymized genomic data sets by linking up with ancestry databases, where people post genetic data about their related to their ancestry, and also post family trees. You can derive a certain extent of identities from those. And once you have data shared openly, although put an asterisk on that, and it depends on how open we're talking, the genie's out of the bottle. Once you have removed governance protections from a given data set and released it to some other group or individuals, that removes the ability to control further security measures on the data set once it's been released. But you might say, well, this is outdated. We have now today very sophisticated security mechanisms, very secure anonymization techniques. There's still an ethical trade-off to think about. Okay, and this is about thinking about privacy and public interest. Okay, privacy is not just about preventing people from accessing your data without permission. People also have an interest in how data about them is used, right? Including, was briefly mentioned in the talk about the trust platform, there's the idea of social value, this idea of public good, as contrasted with private profit. And there is often a general expectation and a reasonable belief that some of these data uses, some of these instances of data sharing will generate value for the public through innovations that can improve human well-being. But not all uses of data might have those effects, or not all uses of data might be so anodyne or so socially beneficial. And so protecting that interest in promoting social value and uses of data often falls to data stewards, data access committees especially. But open data, at least in its purest form, right, just posting data sets, even anonymized data sets online, is inimical to that idea of control, right? Once you release data, you're giving up control over it. So it's truly open. That would mean there's no conditions. That's an extreme, and maybe no one really wants to promote that extreme. But when you start thinking about conditions and protections, right, restrictions that are meant to ameliorate these sorts of things, and the trust platform is a great example, where you have all these different layers of protection. You have approval of individuals, credentialing of individuals that have access to that. You have individual projects that need to be authorized by the trust platform. And then there's a couple other layers of approval, I think, of publication as well. Right? All these different layers of approval are restrictions and conditions that reduce the breadth of individuals that could access and the breadth of purposes for which data can be used. Again, maybe justifiably so, but it is a way that openness is limited in a way. Not that openness is eliminated, but that it is limited in the interest of ensuring public trust, ensuring that data is used in a way that we can support and that we can minimize the potential harms either to the individual or to society from those uses. Indeed, some uses themselves, beyond the risk to individuals, can be harmful if you look at misinterpretations of findings, especially when certain studies, when you're looking at correlating data sets of sensitive pieces of information. It was mentioned briefly, I think, there's a socioeconomic status. There have been some studies on socioeconomic status, increasingly an area where we are getting a lot of insights between those correlations and health outcomes. But there's concerns that such research, if framed improperly, can lead to stigmatization. This gets especially acute once you look at categories such as race or ethnicity, where again you might find interesting correlations can accrue. But if you actually publish these results without sensitivity to these issues, that improper inferences can be drawn and stereotypes can be reinforced. This isn't to say that the fact that there are these tensions, these ethical tensions, means that we cannot proceed, that we must just have fully restrictive oversight mechanisms. It might be that in many cases, the benefits of more open sharing, of relaxing restrictions, outweigh those costs, outweigh those pitfalls in terms of potential misuse, but also in terms of limitations on the social value that we can ensure from those data uses. But I think it's just important to acknowledge these tensions, to acknowledge the ethical costs of increasingly open data sharing. And that means finding the appropriate balance and degree of openness and security and promotion of public interest in data uses. And in turn, that means when we have platforms, and I think it was a great presentation on the trust platform, that are opening up data to more and more researchers, that it is publicly defensible, right? That people, independent of, not just talking about consent forms, people sign up for a study, a genomic study, and what's in there, more broadly to the public. When these platforms are created, when these data, data from housing, data from our finances maybe, are collated in ways we might not expect, that it's defensible to the public. That people will, when they see these data platforms being used, when they see results being published, results from maybe their own data that had been put in for other purposes, that they're comfortable with those uses. They're confident the way it's been used is responsible, and there won't be backlashes that sometimes has happened in other contexts when data didn't secure what's sometimes called the social license. Okay, in the remaining time, I'm going to shift gears because I also want to talk about, I know very briefly, about this area of open access, right? Open access publications, particularly, right? And this is an area internationally where there's been a lot of movement in the last maybe 10 years, particularly out of Europe. We have this Plan S, which has from 2021, it's come into effect, where scholarly publications that receive funding from various European funders need to be published in these open access journals. These are and they don't even allow hybrid plans. These are open access journals where everything that's published there is open access, or being made available through repositories without embargo. And more recently, just a few months ago, again from Alondra Nelson, the White House, there was an announcement of a reform to the existing NIH and overall U.S. funding open access policies. Used to be this had this year-long embargo, right, before they were required to get U.S. funded research to be open access, and they're basically eliminating the embargo as long as some other reforms. So a clear move in terms of trying to improve public access to publicly funded research, at least from the U.S., Europe, and other jurisdictions. And I want to think about this, this actually seems like a good thing, of course. This publicly funded research shouldn't be made available to the public. And we can think about this as transitioning research outputs, right? Transitioning the knowledge gained from research from an excludable good, right? From a good that is excludable based on access to subscription to certain journals, which was really held only by certain institutional affiliations, to a public good in the economic sense of something being non-excludable, right? Something where you cannot, because it's open access, it's available freely online, you cannot exclude anyone from accessing those insights, right? And so public good in this economic sense, I should say, as being ethically driven by at least two factors. So one is the public benefit that can accrue from openly posting this research, but having more and more research being able to access insights, having that knowledge, be able to generate further insights, and also practitioners, of course, who are able to, who might not be part of institutions that have the full range of subscriptions necessary to access all these journal articles, to be able to access those insights and reform their practice based on the published results. But then beyond just sort of practitioners and researchers, there's also general public interest, right? And this gets back to the idea that this is publicly funded research, from Plan S and from the NIH, where taxpayer money is used to fund research. And this idea that the public has a right to access that knowledge gained. Some of them will be doing it out of curiosity, just idle interest, or just the principle of the idea that they shouldn't be excluded from being able to access the knowledge that they themselves paid for. That is the general public, the general taxpaying public. But there are some issues in terms of how we distribute the costs of ensuring people have access to publications. So one important consideration is that, well, at least in the current model of publishing, is that this is a for-profit model for most journal publications, most high-impact journals in most fields, right? And this idea of gold publication model, where you pay a fee, thousands of dollars, to publish open access. That's expensive. If you don't have a line item in your budget, in your grant for that, you won't be able to access such things, to access such open access journals or such open access services. So one way of thinking about this open access issue is who should pay for the cost of accessing findings? Should it be readers or users of research that pay for the privilege of being able to access this? Or should it be the producers or funders of research, the ones that fund research through grants or through research's other sources of funding that themselves put a line item to make something open access? And we can think about this as a distributive justice question about who should bear the costs of ensuring this benefit can be accrued to certain parties for sharing knowledge generated from research. And one principle of distributive justice that's very useful, comes from this Rawlsian tradition, is to maximize the benefits to the worst off, right? To look at who in this kind of distributive scheme is really kind of most suffering, so to speak, and how can we ensure they're best off. And there are distributive advantages to the subscription model, right, that gold model, because you could say, well, look, you have a free to publish model, right? Researchers who don't have as robust funding, or who funders themselves don't have budget items for open access, they can publish wherever they want, any journal they want, without restriction and without worry about having to pony up any funding, right? And the costs of accessing fall on institutions that themselves arguably derive the benefit, right? Research institutions that will themselves produce research, and since they're getting some institutional benefit from that, especially if you're looking at for-profit companies that are getting access to these journal publications, they're getting monetary value out of that. Maybe they should be the ones paying for it, right? So there's some distributed argument there. But the big distributed disadvantage to this gold model is that the users, researchers, or public who cannot afford the journal subscriptions, and these journal subscriptions are very, very expensive, especially for those that don't have an institution to pay library fees, that have libraries that can pay for these fees, are priced out of this entirely. And that's a very large, probably a larger field of individuals than those that are conducting the research themselves. And that's an inequitable distribution. So the open access model, right, the kind of S-plan model in particular, you have this advantage where it becomes free to read, right, where the burden is relieved from researchers, practitioners, and so forth to be able to access without cost. But then the converse issue comes up, that researchers without those open access funding become priced out of certain journals, certain open access journals. In my field, biomedical ethics, the BMC medical ethics is a very important and prominent journal. But if you can't pay the open access fees, you can't publish in that journal. That restricts the range of where you can publish and your ability to maximize your impact of your research. Private institutions also could potentially free ride. So private institutions are going to be gaining profit potentially from novel knowledge gained from these publications without having to pay for it. And that free riding, obviously, well, arguably, I should say, is problematic. But when you're trying to weigh these up, I think you can make a good case that in terms of protecting the worst off, the way to resolve all these dilemmas is to get rid of these open access fees as the long-term goal, right? So if you can get rid of that, break down those fees, find a way to publish without having these thousands of dollars, then you wouldn't have this distributive dilemma, right? And the worst off, those who can't afford either to publish or to read, they can get access without concern. But it's not just for-profit publishers that are charging high fees. For example, Cambridge University Press has, I think, 4,000 Sing dollars for certain journals that I looked up for their publication fees. It's not just about profit extraction. Only we had a lot more not-for-profits funding publications. There seem to be a large number of costs associated with at least the current standard of publication. So in the interim, while we try to get reduction of open access fees and more affordable publication models, there's some ways to try to mitigate these burdens, right? Different approaches. So one is that memorandum that I posted earlier, which is a green model, right? And the idea there is, well, okay, you can still have your publication in a for-profit journal that and it's not open access there, but you also have the the preprint version, right? Or the penultimate version, or the version right before it's been formatted, published in a repository, right? Published in PubMed or another open access repository that has all the substance, all the content, all the knowledge, just maybe not the nice formatting, not a few typos fixed, and so forth. And that model is a way to avoid fees at either end while still having a version of record that is kind of in the official journal. But it might have unintended consequences if you have a very large mover in this area. So until recently, we had this 1-year embargo on that model, and that 1-year embargo still gave a lot of incentive. If you were an institution, you want to be able your researchers to access knowledge as it's gained now, not a year from now. You still want to pay for those subscriptions. But what's going to happen once the U.S. is switching over to this model? Will a lot of institutions that look at dropping these subscriptions, subscription or looking to renegotiate these fees? Will that actually end up pushing subscription costs higher, open access costs higher? So there might be some unintended consequences, though it remains to be seen when a large player like the U.S. Suddenly changes its open access model. Another approach is this diamond or platinum approach, where again we try to fund these journals that have no open access charges, no submission costs, right? The real ideal, the ethical ideal, and get more and more of these journals up and running. There are a few journals like this out there. But that means we have to really support these journals. It means supporting them not just financially. It is expensive to set up these. You have to have some sort of constant stream of subsidy for them, typically. It also means as researchers to not only publish in those, but actually read them, right? Because one of the things that's really important is that impact factor and that citation count. So actually having a system where researchers privilege reading and reviewing for these diamond or platinum open access journals, can move the needle, at least in the individual level, even if you don't have the ability to, say, fund yourself on a fully open access diamond or platinum journal. And finally, there's this option of this gold plan. It's Plan S, right? But where you have subscription open access journals, I should say, where a fee is paid by the researchers or the grantors. And interestingly, one feature about that tries to mitigate Plan S, that tries to mitigate the unfair burdens on different researchers, is that low and middle income researchers would get fee waivers under Plan S or fee discounts to try to address some of those distributive injustices. But that still leaves within higher income countries, different people have different affiliations, and their funding might be differential. So it doesn't fully address the equity issues in terms of ability to publish. Okay, so that's just an overview of the different ethical trade-offs involved. I think it's still, is positive towards the ethical promise of open access and open data, but just to be aware that there's downsides and trade-offs to be considered and to be mitigated in looking at these policy options. Okay, thank you very much.